Hello everyone, I'm Tashka Nine, a professional massage therapist for 27 years, and this is part one of a video series which is going to help you be able to massage family members or friends that might have chronic pain or other health issues. I'll share just a little bit why I'm creating this series and what inspired me. And I'll have to say the bottom line is, not everyone can afford to get a massage. Not everyone can afford to get myofascial bodywork, which is my specialty. So, my heart goes out to people that either, I don't want to say can't afford it, but, I understand we all have a budget. Most people have a budget, and it doesn't always fit into it with other things going on, and inflation is certainly rising. So my intent with this video series is to empower people that aren't necessarily professional massage therapists, nor do they want to be, but they'd like to perhaps help their loved ones being able to have this skill set to give them a massage, whenever they can. So I think maybe I'm thinking of families, father, son, daughter, mother type thing, or maybe you have a group of friends and you guys want to practice doing some massage techniques, do trades, things like that. So first, I'm just going to say this is a disclaimer. Got to get that out of the way. As massage therapists, we're not allowed to diagnose. So it's very important that if someone has chronic pain or another health issue, that you don't try to replace other healthcare providers with this work that I'm going to show you. So you want to be complementary to them. Be a part of the healthcare team, not necessarily replacing anybody. And it's important to get a proper diagnosis so you know what you're working with. Because there are contraindications to getting a massage, getting body work. So I'll just give a couple examples. One example is if you are working with someone who is actively in chemotherapy for cancer or radiation therapy. First of all, the radiation, if they've just recently received it, is probably not going to be good for you to be touching them right away. The other thing is it can be painful for people going through chemotherapy to get deep tissue massage or other types of deeper, like a myofascial or a structural integration, a Rolfing session. So I'm going to do my best. There's going to be probably the first 6, I would say, parts. I'll just be talking. I'm not going to get right into the protocols because, quite frankly, you can go on YouTube and find just about any protocol for any body part. And it's really not the purpose of what I want to teach you. I look at massage and body work as sort of like a chef looks at cooking. I'm going to give you some recipes, but ultimately you're going to, like all healing, it's a healing art. It's an art. So you take that recipe and you make it your own. At first, you're going to use the protocols because that's what we do. You have to do that. But as you get more and more comfortable with the techniques, as you develop your intuition, which is something I'd love to introduce you to, you're just going to get better with practice, and you'll be able to take this recipe and tweak it and make it your own. I just want to introduce you to energetic boundaries. So please just bear with me, follow with me. I want you to imagine video, and I would suggest that you practice every technique that I teach you and actually come back to these videos, each and every one, reiterate, study, and practice. It's just what we do. We're practicing. Surgeons practice, doctors practice, massage therapists practice, and it's what we call our businesses. They're our practice, because that's what we do. So here you are, you're just letting that energy, that matrix, you can really start to feel this divine matrix. And as you work on your patients, I want you to be aware of this divine matrix, because we want to work with it. We want to make friends with it. And this is ultimately how we're going to continue to develop our intuition as body workers. So, before you put your hands on someone, I want you to recognize that they have an energy field, you have an energy field, and you want to have a boundary between the two. The reason you want to have a boundary is because there is an actual phenomenon. It's called transference. You can look it up. It's a psychological term. It basically means if you get too attached to an outcome with your patient, you can literally take on their stuff. So if they're sick, you might get sick. If they have a pain somewhere and you're overly attached to fixing that pain, you might get that pain. So what you want to do is pray. You don't have to pray, but I pray. It's not a religious thing for me. It's just a way that I communicate with Creator. If you're not religious and you don't have a particular belief in God, that's fine. But I would love for you to have an intention and be aware that you are going to be working with energy. I happen to know that this is a divine energy. And it's a privilege to work with it, but that's something that you may find over time if you continue with this work. So ultimately, we're trying to visualize a window between ourselves and the client. Why a window? Well, a window is still a boundary, but it also allows light to flow through it. So before I start my sessions, I ask the Lord, I just say, hey, please let me be a vehicle for your love, your healings, your blessings to come to me and through me. But I also imagine that there is a boundary energetically so that I don't empathically take on other people's stuff. And since you're going to be working with loved ones, family members that you are going to be attached to, you love them, it's even more important, and that's why I bring this up. So something to keep in mind. I may or may not talk more about it in a future video. But just play with that. Play with the idea that, you can, there's something there. You can feel that. And you're not just two physical bodies. When you're massaging someone, there's an energy there. There's more than just the physical. And hopefully you can be a window for this beautiful divine light, the healings and blessings to come through and benefit your patient. But there's a caveat. The second step is to surrender the outcome. So you want to say, however you pray it or however you ask to be that vehicle, then say, at the end of the session, I surrender to thy will. Whatever is best for this person that I've just done my best to help, please let that be in your eyes. So your will be done, not mine. And it's kind of a let go and let God thing too. This is a way of washing your hands at the end of the session. You're you've done your best and now you're surrendering the rest. So that's pretty much all I want to say in this introductory video. I hope that you're inspired to watch this video, or if you know someone who maybe doesn't get body work because it just is a little out of their price range, or if you know some people that are curious, they're not professional massage therapists, nor do they want to be, but they'd like to learn and perhaps develop their intuition skills, because this is one of the greatest ways to develop your intuitive nature. Being in a place where there's no distractions and you're just giving to another soul, to another body. And anyway, I'm really grateful that you watched this video. I hope you'll subscribe, because if you do, you'll be able to see the rest of the series. And I wish you all the best with this. I hope that this video helps you, and the ones to come will also help you. Thank you.